Hello, welcome back to my new video about laboratory diagnosis of fatty liver disease. Do you know how important is the liver in your body? Do you care about the health of your liver? Do you know that by doing some simple tests you can understand the situation of your liver, and if you have liver problems such as fatty livers, you can prevent it before it becomes acute and leads to cirrhosis or liver failure? In this video, I'm going to talk about this matter. So please follow me until the end of this video by clicking the subscribe link below the image. The liver is a red-brown organ with a wedge shape and two lobes of unequal size and shape. The human liver weighs approximately 1.5 kilogram and is located in the upper and right part of the quarter of abdominal cavity. The liver is connected to two blood vessels, the hepatic artery and portal vein. The hepatic artery carries oxygen-rich blood from the aorta, while the portal vein carries blood rich in digested nutrient from the entire alimentary canal to liver. These blood vessels are divided into small capillaries. Uh, the liver has about 500 different functions in the body. The most important function of the liver include the hematopoietic activity during the embryonic period, production of proteins and biomedical substances necessary for body growth and food digestion, purification of substances that have been absorbed by the body through the digestive tract, and some other important function that you can write in caption. The most common liver disease is fatty liver, which affects more than 30% of people to varying degrees. In general, the cause of this disease can be considered to caused by improper diet, stress, taking more than usual medicine, and fast food. Uh, so the causes of this disease can be mentioned as follows: alcohol consumption, nutrition, lifestyle, overweight and obesity, high blood fat and sugar, old age, genetics, smoking, history of some infections such as C. hepatitis, taking some drugs such as methotrexate, pregnancy, polycystic ovary syndrome, and exposure to certain toxins. Methods used to diagnose fatty livers include blood tests, which includes liver enzyme function test, imaging, which is done through the different methods such as CT scan, ultrasound, or MRI, liver tissue biopsy, in which a small part of the liver is removed by a needle. Liver enzyme test includes alkaline transaminase, aspartate transaminase, and alkaline phosphatase. Liver function test includes PT, INR, PTTR, and albumin and bilirubin. Liver cells contain proteins called enzymes that play a role in the metabolic activities of the liver. When liver cells are damaged, intercellular enzymes are released into the blood, which can be measured with a blood test. The greater the damage to the liver cells lead to the higher the amount of these enzymes in the blood. The two main liver enzymes are alanine transaminase or SGPT enzyme, which is only in the liver, and aspartate transaminase or SGOT enzyme, which is also in the heart muscle and other tissues near the liver. If these two enzymes are high in the blood, it can be seen that the liver is damaged. One of the functions of the liver is the production of bile, which helps digest fats. When the flow of bile decreases or the bile duct is closed, certain enzymes increase in the liver. These enzymes are alkaline phosphatase, 5'-nucleotidase, and gamma-glutamyl transpeptidase. If the amount of these enzymes in the blood is high, the problem is in the flow of bile. Some of the blood coagulation factors that play a role in the formation of clots and preventing bleeding are made in the liver. So the prothrombin time or PT and thromboplastin time or PTT that measure the internal and external pathway of coagulation can be increased in liver disease. Albumin is one of the main proteins in blood, which is made by the liver and has the role of carrier protein for various components in the blood. And people with chronic and severe liver disease have a low amount of albumin. When red blood cells break down, bilirubin is produced. The liver metabolizes this bilirubin and extracts it through feces. Bilirubin dissolves in bile. In people who have disorder of bile flow, severe liver disease, and gallbladder disease, the amount of bilirubin increases. A large amount of bilirubin causes yellowing of the skin and whites of the eyes. Although liver biopsy is one of the most accurate methods of examining the damage in the liver, but due to the sampling error in the biopsy and changes between different observers, today Fibro test by examining 6 blood factors. It's used as a non-invasive method to diagnose liver damage and fibrosis. Uh, the value of Fibro test is calculated from the result of 6 blood tests parameters according to the age and gender of the patient. These tests include alpha-2 microglobulin, haptoglobulin, apolipoprotein A1, gamma-glutamyl transpeptidase, total bilirubin, and alanine transaminase. More than 95% of Fibro test results are interpretable and enable diagnosis of fibrosis and liver activity. False positive probability has been observed in less than 5% of cases. Fibro test is approved for chronic hepatitis C and B, C or B hepatitis, co-infection with HIV, alcoholic liver disease, fatty liver, and non-alcoholic fatty liver disease. Fibro test is independent of geographic location, sex, genotype, viral load, transaminase, or presence of concurrent disease. This test has been approved in people over 65 years of age, children, patients with kidney abnormalities or kidney transplant, hemophilia, people with chronic inflammatory disease, and the general population. Fibro test is not applicable in 5% of cases. These substances can be identified by laboratory safety algorithms when obtaining test results, which are acute hepatitis, such as acute viral hepatitis A, B, C, D, E, and medicinal hepatitis, severe hemolysis in some heart valves, Gilbert's syndrome with high unconjugated bilirubin, acute inflammatory syndrome. You can see some benefits of fibro test in comparison to biopsy in this table, such as the cost of test, repeatability, risk-benefit ratio, and so on. Thank you for your watching, and I hope to be in health and goodness. Bye.